In this screencast, we're going to discuss how to use an AED. An AED can be used for adult, child, and infant. We're going to discuss how to use it on an adult, and then at the end we'll talk about what some of the differences are. And like we mentioned in some prior screencasts, we use an AED when we have a victim that is unconscious and they're not breathing. The way things are right now, many public places such as buildings, school buildings, government buildings, shopping malls, etc., many of these are equipped with AEDs. All of our high schools within our district have AEDs, and once again, these can be life-saving devices. More often than not, CPR has already been started. Somebody has gotten an AED, they brought it to the location where the victim is at. As soon as the AED arrives, you would stop performing CPR, immediately get the AED hooked up, and let the AED do its job. The nice thing is even though we're going to discuss how to properly use an AED and some of the precautions that we need to take, somebody who's never used an AED before could use one because many of them are set up in such a way that even if you've never used one, it walks you through step by step, once again, how to properly use an AED. AED, once again, stands for Automated External Defibrillator. Most people in sudden cardiac arrest, they're going to need defibrillation. Defibrillation is an electrical shock that interrupts the heart's chaotic electroactivity during cardiac arrest. So what's happening is that person's in cardiac arrest, either they are not pumping any blood throughout the body, or they're not pumping enough because it's so abnormal and it's so chaotic and it's so irregular. So what the AED is attempting to do is to take a heartbeat that is chaotic or disorganized and try to shock it and get it back into a normal functioning heart rhythm. For every minute that defibrillation is delayed, it's going to reduce the chance of survival by about 10%. So even though CPR is a really important thing for us to be performing, and we can perform CPR in conjunction with the use of the AED, many times CPR is not going to be enough, and the sooner we can get an AED there, the greater the likelihood is that we can help the victim and hopefully prevent it from becoming a fatality. AED stands for Automated External Defibrillation. There's abnormal rhythms leading to cardiac arrest. You have ventricular fibrillation and you have ventricular tachycardia. Both of these is when the heart is in an abnormal rhythm. There's not adequate blood flow. In some situations, it's just a fluttering of the heart, or it's beating too fast, or it's beating too slow. And in many cases, these can be corrected with early defibrillation. So once again, what that defibrillator is going to do, it's going to send a shock into the body, and it's going to take a heart that is either fluttering or it's beating too fast or too slow, and it's going to shock it to try to help that heart regain a normal electrical rhythm, and that way it can adequately pump oxygenated blood throughout the body. AED, this is a device that's going to analyze the heart rhythm. So the first thing we're going to do is we're going to turn that device on. We're going to follow the instructions. We are going to apply the pads on the victim's chest. We're going to plug the electrodes in, and we're going to allow the machine to analyze the heart rhythm. And that machine is going to make a determination on whether or not we need to shock the victim and when that shock is supposed to occur. It's going to deliver a shock if needed, and it's going to help to disrupt any abnormal rhythms. We use it as soon as it's available. So as soon as it's available, as soon as we have it turned on, we stop our CPR only when that AED is ready to use. So when the AED shows up, we're going to continue CPR, and somebody else is going to get the AED turned on, and we're going to follow the prompts, and as soon as that AED is ready, we would stop CPR and then let the AED do what it's designed to do.
Every year, thousands of people die of sudden cardiac arrest.
She's unconscious. Go to the front desk, call 911, and bring me the AED.
Following the links of the cardiac chain of survival can help save lives. The sooner 911 is called, the sooner advanced medical care will arrive. Early CPR helps circulate blood that contains oxygen to vital organs. Most people experiencing sudden cardiac arrest need an electrical shock called defibrillation. Continue CPR until an AED is ready to use. An AED, or Automated External Defibrillator, is a portable electronic device that analyzes the heart's rhythm and determines if an electrical shock is needed to help the heart restore an effective rhythm. Most AEDs can be operated by following these general instructions. Turn on the AED. The AED will tell you what to do next.
Press pads firmly to patient's bare skin.
Make sure the person's chest is bare and dry. Use a cloth or gauze pad to dry the person's bare skin where the pads will be placed. Remove the pads from their packaging. Carefully peel off the backing from one pad and place the pad on the upper right chest. Place the other pad on the left side of the chest. Plug in the connector to the AED if necessary. The AED should start analyzing the person's heart rhythm.
Analyzing heart rhythm. Do not touch patient.
Analyzing.
Do not allow yourself or anyone else to touch the person while the AED is analyzing.
During shock, move away from the patient.
Make sure that no one, including you, is touching the person.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
After a shock is delivered, or if no shock is advised, give about 2 minutes or 5 cycles of CPR. When 2 minutes have passed, the AED should automatically begin to reanalyze the heart rhythm and will advise you with a prompt to stay clear of the person.
Do not touch patient. Analyzing heart rhythm.
Continue to follow the prompts of the AED and provide care as needed.
It is now safe to touch the patient. Start CPR.
If at any time you notice an obvious sign of life, such as breathing, stop CPR, maintain an open airway, and monitor for any changes in condition. An AED can also be used for children and infants who are not breathing. Use pediatric pads if they are available. Operate the AED and apply the pediatric pads to the child's chest the same way you would for an adult.
Do not touch patient. Analyzing heart rhythm.
Analyzing. Everyone stand clear.
For a small child or infant, the pediatric pads may be too large to fit on the chest without touching each other. You may need to attach one pad on the center of the chest and the other on the back between the shoulder blades. Here is how you would work with a second trained responder when using an AED. One responder continues CPR while the other prepares the AED. This is another example of how CPR and an AED work together as links in the cardiac chain of survival. One responder continues CPR while the other attaches the AED pads and operates the AED.
Do not touch patient. Analyzing heart rhythm.
Everyone stand clear.
Preparing shock. Move away from the patient.
Shock advised. Everyone stand clear.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
Some precautions when using an AED. Once again, the previous video did a great job demonstrating how to properly use. Once again, it can be used for an adult, child, and for an infant, but there's obviously some precautions that we have to pay attention to make sure that we are safe, other responders in the situation are safe, as well as the victim. Do not use alcohol to wipe the chest dry. Alcohol is obviously flammable. With that electrical shock, a serious burn could occur. Do not use incorrect size pads unless no other pads are around, which means don't use a child or infant pad on an adult, and don't use an adult pad on a child and an infant. Do not touch the person while the AED is analyzing, before shocking, or during defibrillation. The reason why that is if we are touching a victim while the AED is analyzing, our electrical activity could actually be misread by the AED as if there's actually a pulse when there isn't. And if we're shocking the victim and we are touching the victim or another responder is touching the victim, we could become shocked and he could take a normal heart rhythm and put it into an abnormal rhythm. Do not use flammable or combustible materials in and around because of the electrical activity. We don't want a spark to occur and a fire or a burn to set in, and do not use in a moving vehicle. The reason why that is because of the movement of the car. The AED is going to have a very difficult time analyzing whether or not that victim has any heart rhythms. Some other precautions: do not use on a person in contact with water. So if you have somebody who is wet, maybe it's a drowning situation, we pull them from a pool, we pull them from a lake, we need to remove them from water. Be sure there's no puddles around you, the person or the AED. We need to remove any wet clothing. We need to dry the person as much as possible, especially in the chest, before we attach those pads. If it is raining, keep the person as dry as possible, shelter them, use an umbrella, possibly move the victim if we need to. Ensure the chest is wiped dry, and we want to minimize delaying defibrillation to provide a dry environment. Once again, contact with water is something we really need to avoid, and we need to get that chest as dry and as quickly as we can. Other precautions: do not use on a person wearing a medication patch. So anyone who has a nitroglycerin patch or something, we don't want to use it over that patch. We want to remove any patch with a gloved hand before attaching the pads. Never place pads on top of a medication patch. Many times it's people who are taking nitroglycerin because of their angina. Do not use within 6 feet of a mobile phone or radio. The reason why that is because of the electrical activity coming from your cell phone or radio. Once again, the AED is going to have a hard time analyzing the rhythm, heart rhythm of the victim. Do not use directly over a visible or known implantable device. So if somebody has a pacemaker or something in, you don't want to put it over the top of that device because it's going to, once again, have a hard time analyzing and reading the electrical activity of the heart. So we'd have to just adjust the pad placement. We know we have a pad in the upper right and the lower left. If we have to adjust that a little bit, that's going to be okay. Other precautions: if the person has hypothermia, so they're in a cold situation, maybe very cold, it was windy, the victim is wet, etc., remove any wet clothing, and we want to dry that chest as quickly as possible. While CPR and AED use continues, protect the person from further heat loss, cover them with a blanket, etc. Do not withhold CPR AED to rewarm the person. And do not shake the person. Shaking the person could cause other complications, especially if the AED is connected and attempting to analyze. And lastly, if there is excessive chest hair, which can certainly happen, especially if it's a male victim, you can press firmly over the chest pad. If the pads will not attach because there's too much hair, you're going to remove those pads quickly. So put the pads on, and kind of like a band-aid, you're going to pull it off right away, and you're going to attempt to put new pads over the top of the chest. If you continue to get check pad message, we want to remove those pads as quickly as we can. And many times in the AED, within that box where the pads are, there's going to be a razor as well. We could quickly shave the person's chest before we attach those new pads. So once again, you have somebody who has excessive chest hair, you throw the pads on, it can't analyze, you rip the pads off, you put some new pads on. If it's still having a hard time analyzing, rip the pads off a second time, shave the person's chest as quickly as you can, and attach new pads. A metal surface is safe as long as the pads do not make contact with it and no one is touching the person when the shock is delivered. And the last thing on here is: do not place pads directly over jewelry or body piercings. It doesn't mean you have to take the time to take the piercings out. It just means you do not put the pads over the top of those piercings, which means if you have to adjust those pads a little bit, you certainly can. So once again, we use an AED on anyone who is unconscious and they're not breathing. More often than not, CPR has already been started. As soon as the AED is going to arrive, we want to stop CPR. We want to get the AED going, allow the AED to analyze the victim, and follow any prompts. Once again, we can use an AED on an adult, on a child, and an infant. The really only noticeable differences between all three would be the size of the pads and also the placement of the pads as well.